Dear first year students, welcome to this lecture about iron deficiency anemia. The objectives of this lecture in front of you. By the end of this lecture, the students should be able to describe briefly iron metabolism in human body, mention briefly the importance of iron for a human being, define the term anemia, enumerate the causes of iron deficiency anemia, describe briefly the effect of iron deficiency anemia on health, and describe briefly the diagnosis and treatment of iron deficiency anemia. We start with a clinical scenario. A 20-year-old female college student presented with a 3-month history of becoming pale, easy fatigability, and difficulty in concentration. She cannot concentrate in her college study. She had also palpitation on exertion. When she climbs stairs, she will start to feel her heart beating fast. When we examined her, the clinical examination revealed that she was pale and she had a smooth tongue. The surface of the tongue is smooth. So what is the most likely diagnosis? This presentation is a typical presentation of a patient with iron deficiency anemia. So we come to have a few notes about iron, and I believe that you have been given these information in the biochemistry. Iron is among the abundant minerals on Earth, and in human body it is needed for the following: for reversible binding of oxygen, and the iron which is present in hemoglobin serves this purpose. It is also important for enzymes like cytochromes, and it is also important in body immunity because it is part of the free radicals that destroy the microbes. The daily iron demand differs according to the age and the gender of the person, and these values are for normal people. Males need 1 milligram of elemental iron daily, while adolescents, because of the demands for growth, they need 2 to 3 milligram per day, while women in the reproductive age, between the age of menarche to menopause, they need 2 to 3 milligram of elemental iron because of the loss of iron in the menstrual blood flow. And pregnants, they need daily 3 to 4 milligram because of the demand of the growing fetus. And the total amount of body iron is between 3 and 5 grams. It is a small amount, but it is essential for life. The dietary iron is present in 2 types: the heme iron and non-heme iron. Heme iron is present in hemoglobin containing animal food like meat, liver, and spleen, and it is absorbed rapidly, while the non-heme iron is obtained from cereals, vegetables, and beans. Milk is a poor source of iron, and therefore breastfed babies need iron supplements. Iron absorption is an important process for the human being. The heme iron, which is present in meats, is absorbed better than the non-heme iron, which is present in the grains. The gastric acid is important because it keeps the iron in the reduced form, in the ferrous form, that is easily absorbable. And the absorption of iron occurs mainly in the proximal small intestine. And iron absorption is increased when the patient is having anemia that causes increased demand or increased erythropoiesis. It is also increased in the presence of sugars and amino acids. And iron absorption is inhibited in the presence of chronic inflammation and when the person consumes large amounts of tea because of the presence of phytate that chelate iron and prevent its absorption. So the iron that is absorbed from food in the proximal small intestine is directed to the erythroid precursors in bone marrow to produce hemoglobin. Then the red blood cells, when they become old, they are destroyed in the macrophages in the spleen, and iron is liberated and carried in the by the plasma to the bone marrow for synthesis of hemoglobin. There is very small amount of iron that is lost from the body in the lost hair and exfoliation of the skin, and very, very small amounts in the urine. Iron is stored in the body, also in the liver and in the bone marrow reticuloendothelial system. In the liver, it is stored in the form of ferritin, and in the reticuloendothelial system, it is stored as hemosiderin. Now we come to define anemia. Anemia is defined as reduction in the number of red blood cells or hemoglobin concentration or packed red blood cells or PCB value below the lower normal limit for age and sex. And anemia is not a disease. It is a manifestation of different diseases. And in this map, you can see that anemia is a global problem in the world. You see that anemia is prevalent in many countries. And you see that the more the prevalence of anemia, the more the deep color of the country. And you see that anemia is very prevalent in Asia and in Africa and in South America. And iron deficiency is the most common micronutrient deficiency in the world. It affects uh, around 1.3 billion people, around 1/4 of the world population. And the causes of iron deficiency include either there is increased demand for iron, and this is especially seen in children and females, especially during the reproductive life. And the other important cause is chronic blood loss, and this is mainly in adult females, in adult males. Also, other causes include malabsorption of iron, like patients who have celiac disease, or if there is inadequate iron intake, like old people who cannot chew meat. And there are also rare causes like intravascular hemolysis. And sometimes we find more than one factor in that person. For example, old person who cannot chew meat and also has a GIT problem that causes a blood loss. Now, this is for you. If you can enumerate some people who are at risk of developing iron deficiency, and you will have 1 or 2 minutes to discuss this issue, and you write your answers, and we will resume the lecture again. So, at-risk groups who are liable to develop iron deficiency include infants, because their food is deficient in iron. Also, under 5 children for the same reason. Children of school age, because they like to eat foods that do not contain iron. They don't like meat and so on. And also women of childbearing age, because of the increased demand, because of blood loss in the menstrual blood flow, and also because of a pregnancy. Iron deficiency anemia occurs slowly. First of all, there will be depletion of iron stores, and after that, the iron deficiency uh, will cause iron deficient erythropoiesis, and then in the last stage, the hemoglobin will drop and the anemia will appear. And it is interesting to see that the RBC morphology is normal until the last stage, where the red blood cells become hypochromic and microcytic. Okay, so a patient with iron deficiency anemia usually presents with a slowly progressive problem. The symptoms include fatigue, dizziness, palpitations, especially on exertion, blurred vision, difficulty in concentration. Sometimes there is dysphagia in old women. And when we look at the patient and examine the patient, we can find pallor. Sometimes, not always, we find smooth tongue, loss of the papillae of the tongue, and also change in the shape of the nails, what is called koilonychia. And sometimes in old people and in the presence of cardiovascular problems, when they develop iron deficiency anemia, they may go into heart failure. This is a summary of the clinical features: dizziness, fatigue, pallor, flat nails, and smooth tongue. So again, iron deficiency results in the following. There's impairment of physical growth in children, compromised cognitive development. They cannot cope in the school, impaired learning capacity, reduced muscle function. They get fatigue easily. In the adults, there is lower work productivity. Immunity is less. They develop repeated infections, and it may lead to increased risk of infectious diseases. In this picture, we can see the color of the palm, comparison between a normal palm on the right and a left pale palm seen in a patient with anemia. And you see that the surface of the tongue is smooth and it is congested because of loss of papillae. And this is what is called koilonychia, change in the shape of the nail. It becomes spoon-shaped. The laboratory diagnosis depends on finding low hemoglobin level and low Park cell volume. The red blood cells are small in size and contain smaller amount of uh, uh, hemoglobin. We call it hypochromic and microcytic red blood cells. And the serum iron is decreased. There is increase in the total serum iron binding capacity, and the serum ferritin, which reflects the iron stores, is decreased. You will take these parameters in details in the fourth year. This is a normal blood film, the red blood cells, so concentrate on them. And this is a blood film of a patient with iron deficiency anemia. You see that the red blood cells are small and they are pale. The treatment of iron deficiency depends on replacing iron, which can be given as oral tablets, capsules, or syrup, or it can be given by injections. Oral preparations are preferred because they don't cause allergy, but they cause a lot of GIT symptoms. We need to treat the underlying disease if there is blood loss, especially. The hemoglobin will return to normal after around 2 months, and therefore the replacement therapy needs to be given for at least 3 months so that we can replenish or reload the iron stores. If we stop the treatment prematurely and the iron stores are still depleted, iron deficiency anemia will recur again. Blood transfusion is rarely needed because we can correct the anemia by medication. But in some patients who have severe symptoms like syncope or dizziness on standing, we may give them 1 or 2 units of blood until the treatment will come into an effect. So the conclusions of this lecture: iron is an important element for human beings, especially for hemoglobin synthesis. Iron deficiency is fairly common worldwide and is the commonest cause of anemia. The commonest cause of iron deficiency is increased demand in children and blood loss in adults. Diagnosis depends on clinical features and laboratory evidence of iron deficiency, and the treatment depends on correction of the cause and replacement of iron. You can get further reading in Davidson Principles and Practice of Medicine textbook. Thank you for your listening, and I hope I will see you again in the coming years.